Hello, this is Dr. Zehra, and today we will learn about this image of pelvic organ prolapse, different measurements, and this is always a difficult to understand. I will try to make it simple for you. So, the information which I am going to give you today is more than enough to understand this Popq in your exam. And if anybody is asking you in the theory test or in the OSCE, if it's staging, then it will be easy to remember this. All right, so let's discuss and look at this image. And this is the gold standard image for describing the pelvic support. All right, first let's learn that before jumping directly into the image and confusing yourself, just learn 3 points. All right, actually, the 2 points are very important. That any measurements, now concentrate in this first point, any measurement above the hymen. Actually, everything in this diagram is revolving around the hymen. So the measurements is taken uh, as a base. You can simplify more by taking the hymen as a base for the measurements. So any measurements above the hymen is a negative number, and any measurements below the hymen is a positive number. These 2 points, if you are remembering, then it will be very easy to remember this diagram and to learn this stages of a Popq classification. All right, I am again repeating this, that any measurement above the hymen is a negative number and any measurement below the hymen is a positive number. And these measurements are usually taken at the maximum Valsalva when the patient is straining. All right, so we will take the accurate measurements when we can take the accurate measurements when the patient is straining and at maximum Valsalva. So measurements will not vary. All right, when the patient is maximum straining, then measurements will not vary. So that's why these are taken at the maximum straining. All right, so these 2 points now I think you have cleared in your mind, that above the hymen is a negative number and below the hymen is a positive number. Now what are the 6 points? Let's simplify this 6 point. That's what are these 6 points. Okay, just don't make yourself confused by looking this image, because by looking at this image you can easily confused, or it can make you more like, what are these points and I don't know what are these measurements. First learn these, what is A and BA. So always remember, always this, because this you have to learn, that any measurements which contain a small alphabet A, here you can see in this image A and A. So any measurement which contain a small alphabet A is anterior. So what is AA and then BA? Both are anterior. What is the difference? AA is a fixed point 3 centimeter proximal to the hymen. It is the fixed point. But BA is also anterior, because any this measurements contain the small alphabet A is anterior. So BA is also anterior, but it is the more distal portion of the remaining upper anterior vaginal wall. All right, so AA and BA both is anterior. Now leave the point C and D, just come to the point AP and BP. So AP and BP. So where the small alphabet P is coming, P means posterior. P means posterior. So same like AP is fixed at 3 centimeter proximal to the hymen, and BP is the most distal portion of the upper posterior vaginal wall. Alright, so same, but AA and BA is anterior and AP and BP is posterior. Alright, so P, small p means posterior, we all know that. Alright, so let's simplify this. And what about the C and D? C is the cervix or the vaginal cuff scar if they have had a hysterectomy. So C is the cervix if the patient is having a cervix, or if patient have had a hysterectomy, then we will count C as a vaginal cuff scar. And D is the posterior fornix, which tells about the pouch of Douglas. But it is, we will not take this point if the patient is already have a hysterectomy. This point D is removed. All right, because patient don't have a this D point when the patient have had hysterectomy. But C will remain because vaginal cuff scar we will take it as a point C if the patient don't have a cervix. This is the difference. All right. So if the patient has had a total hysterectomy, point D is not applicable because the posterior fornix no longer exists. Alright, so you only measure point C to see how the surgical scar is descending. This, I think it's clear now. So again I am repeating that if the patient have a hysterectomy, point D is not applicable. Point C only we will take, and we will see as a surgical scar as a point C as a descending part. All right. Now GH is the genital hiatus, the opening from the urethra to the hymen. PB is the perineal body, the distance between the vaginal opening and the anus, and the total vaginal wall. TVL is the depth of the vagina when everything is pushed back to its normal position. All right. So these are the three more points. All right. Now, how to make the diagnosis? Please make very clear for the diagnosis, because this is not a very confusing as it looks like. Just remember these stages as a stage 4. So learn these stages by this diagram, make your concept, and it will be easy for you. I know this is very complicated. Just listen to me and make you yourself simplify to learn this, that how they are classifying and how these stages are classified. So stage 0. First we will take stage 0. Stage 0 is the perfect support. There is no descent, nothing, and everything is fine. So stage 0 is the perfect support. All right. Now stage 1. What is stage 1? Stage 1 is the most descended part, but it is still more than 1 centimeter above the hymen. Alright, above the hymen is the descended part. It's not like the stage 0 as a perfect support, it's descended now, but it is still more than 1 centimeter above the hymen. So that stage is, as per the Popq, is stage 1. All right, now stage 2. So stage 1 is clear to you now, that it is descended but 1 centimeter above the hymen. For example, I think this board is visible to you. I will make it more clear to you. For example, this we will take as the hymen. All right. So what is, if we will take this as a above the hymen portion and this is below the hymen portion? Now we will discussing for the stage 1. All right. So what is the stage 1 by definition? It is the descent of this vaginal scar, but it is still above the 1 centimeter. If we will, I am not accurately measure with the scale, but let's suppose that this is 1 centimeter. So this descent is still above the 1 centimeter, but not perfect at 0 where it should be. It is descended. It should be here, but it is descended, but is still above the 1 centimeter. Now we are classifying as per Popq as stage 1 prolapse, alright, because it is still above the 1 centimeter above the hymen. It is descended, but it is still above the 1 centimeter from the hymen. So already in the starting I already told you, just remember this hymen as a base portion, as a because every stages is revolving around this hymen. So this you have to take as a base, and stage 1 is 1 centimeter is a descent, but stage 1 is above the 1 centimeter descent from the hymen, above the hymen. All right. Now stage 2. So stage 1 is clear to you. It is 1 centimeter above the hymen. Now stage 2 is the prolapse is right at the opening, within 1 centimeter above or below the hymen. Now here the descent is now more descent happened, and descent happened somewhere here or somewhere here, either here or either here, within 1 centimeter above the hymen or within 1 centimeter below the hymen, but it should be within 1 centimeter to classify as stage 2. All right, so we will not label as stage 2 if it is above the 1 centimeter, above the 1 centimeter, then it is stage 1. As the descent below is descending below more, and it is coming within 1 centimeter of the hymen, either above or either below, then we will classify it as this stage as stage 2. But for stage 2, always remember that this is within 1 centimeter and within 1 centimeter above and within 1 centimeter below, but it is within 1 centimeter above or below, it's not matter, but within 1 centimeter above or within 1 centimeter below, then it is stage 2. All right. Now stage 3. Stage 3. What is stage 3? Now the prolapse is crossed the 1 centimeter below. The prolapse is more than 1 centimeter and past the hymen, but it is still not fully out. It's 1 centimeter, more than 1 centimeter, but it's still not fully out, and but it is more than 1 centimeter, has crossed this from below the hymen, it's crossed this, so it is stage 3, but it is still not fully out, not fully emerged, but it crossed hymen from the 1 centimeter, more from the 1 centimeter it's crossed. So this now we will classify it as stage 3. And what is stage 4? We already know the whole vagina is outside, complete eversion is the stage 4. I think this video has cleared the basic concept of the prolapse, and this information which I have given to you today is more than enough in the exam. If you remember this diagram and if you remember this stages, this is more than enough to pass the exam, and wish you all the best. Thank you.